Pseudoephedrine is used to temporarily relieve a stuffy nose and sinus pain/pressure caused by infections such as the common cold, flu, or other breathing illnesses like hay fever, allergies, and bronchitis. It works by narrowing the blood vessels to decrease swelling and congestion. If you are using this medication without a prescription, it's important to carefully read the instructions on the package to know when to consult your doctor or pharmacist. Please note that cough and cold products have not been found to be safe or effective in children under 6 years of age. Long-acting tablets/capsules are also not recommended for use in children younger than 12 years. It's important to ask your doctor or pharmacist for more details about using the product safely. It's also important to note that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk of serious side effects, always follow the dosage directions carefully. Do not use this product to make a child sleepy, and do not give other cough and cold medications that might contain the same or similar decongestants. Ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. If you're taking Zephrex-D to self-treat, make sure to read all the directions on the package before taking the medication. If you have any questions, ask your doctor or pharmacist. Take the medication by mouth with or without food, usually every 4 to 6 hours, as directed by the package or your doctor. Do not take more than 4 doses in a day. The dosage is based on your age, medical condition, and how you respond to treatment. Do not increase your dose or take this drug more often than directed. If you're using the chewable tablets, chew each tablet well and swallow. If you're using the liquid form, measure the dose carefully using a special measuring device. Do not use a household spoon because you may not get the correct dose. Different brands and forms of pseudoephedrine are available, so make sure to check your product package for specific directions. Read the dosing instructions carefully for each product because the amount of pseudoephedrine may be different between products. Do not take more pseudoephedrine than recommended. Caffeine can increase the side effects of this medication, so avoid drinking large amounts of beverages containing caffeine, eating large amounts of chocolate, or taking non-prescription products that contain caffeine. If your symptoms do not improve after 7 days, worsen or return, if you develop a persistent headache, fever, or rash, or if you think you may have a serious medical problem, seek medical help right away. Some common side effects of Zephrex-D may include nausea, vomiting, trouble sleeping, dizziness, headache, or nervousness. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. However, many people using this medication do not experience serious side effects. If your doctor has prescribed this medication for you, it's because they believe that the benefits outweigh the potential risks. However, it's important to stop taking this medication and contact your doctor if you experience any serious side effects such as fast, irregular, or pounding heartbeat, changes in mental state, shaking, or difficulty urinating. While it's rare, a very serious allergic reaction to Zephrex-D can occur. Seek immediate medical help if you experience symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. It's essential to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to consult your doctor or pharmacist. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Always follow your doctor's instructions and ask them about the best time to take this medication and the appropriate daily dosage for your specific condition. Before taking Zephrex-D, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any negative reactions to similar medications. It's important to also discuss any health conditions you may have, such as diabetes, heart problems, high blood pressure, kidney disease, and thyroid issues. This medication may cause dizziness, so it's important to avoid alcohol and marijuana while taking it. If you have diabetes, alcohol dependence, liver disease, or other specific conditions, speak to your doctor about using this product safely. It's also important to inform your doctor about all the medications and herbal products you are using before having any surgery. Older adults and children may be more sensitive to the effects of this medication, so use with caution. If you are pregnant or breastfeeding, make sure to discuss the risks and benefits with your doctor before using Zephrex-D. It's important to be aware of potential drug interactions when taking Zephrex-D. MAO inhibitors should be avoided while taking this medication, as it can cause a serious and possibly fatal interaction. Make sure to inform your doctor and pharmacist about all the products you use, including prescription, non-prescription drugs, and herbal products. Also, be cautious when using other medications that contain similar ingredients, such as decongestants like phenylephrine, and always ask your pharmacist for guidance on using those products safely. Remember to not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Zephrex-D and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, hallucinations, and seizures. It's crucial to seek help as soon as possible. This medication is meant to be used temporarily and should not be used for more than 7 days without consulting your doctor first. If you forget to take a dose of Zephrex-D, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Zephrex-D, it's important to check the product package for specific instructions, as different brands may have different storage needs. It's essential to keep all medications out of reach of children and pets. Remember not to flush Zephrex-D down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.